all about SCFE. Slipped capital femoral epiphysis, or SCFE, is the most common hip disorder in teenagers and occurs in about 11 in 100,000 children. SCFE typically occurs between 11 and 16 years old and is more common in boys. The hip is a ball and socket joint that consists of the femoral head, the ball, and the acetabulum, the socket. The femoral head is attached to the rest of the femur by the femoral neck. SCFE occurs when the femoral head slips backwards off the neck of the femur. This can happen because children have an area of cartilage underneath the femoral head, called the growth plate. This is where the bone grows along with the child and is weaker than normal bone. The cause of SCFE is currently unknown and can happen suddenly as the result of a fall, or more often, it can develop gradually over time. There are several risk factors associated with SCFE, including excessive weight or obesity, endocrine or metabolic disorders such as diabetes, thyroid disease, or growth hormone problems, certain medications such as steroids, radiation treatment, bone problems related to kidney disease, family history. There are two types of SCFE. Stable SCFE, where patients can walk and weight bear on the affected hip with or without crutches. Unstable SCFE, where patients are unable to walk or weight bear even with crutches. Children with mild or stable SCFE typically experience pain in the hip, groin, and/or knee on and off for several weeks or months before diagnosis. Pain can often be aggravated by activity, which may cause patients to walk or run with a limp. Because SCFE can present as knee pain, it is one of the most frequently missed diagnoses in children. Children with severe or unstable SCFE typically experience a sudden onset of pain, often after a fall or injury, and are unable to walk or bear weight on the affected leg. Patients often have a difference in leg length, with the affected leg appearing shorter, and may tend to keep their affected leg turned outward. X-rays of both hips are needed to confirm diagnosis of SCFE. The goal of treatment is to prevent progression of the slip and avoid complications. After diagnosis, patients are encouraged to stop weight bearing to prevent further slippage. Surgery is then used to either stabilize the femoral head or move the femoral head back into a normal position. After surgery, patients usually undergo physical therapy to help strengthen the hip and leg muscles. SCFE can lead to potentially serious complications if not caught and treated early, such as osteoarthritis in the hip at a young age, or femoral growth arrest, where the growth plates in the femur close early. Early closure of the growth plates can lead to leg length differences. Like all hip disorders, early detection and diagnosis is key. When caught and treated early, long-term hip function can be very good. If you notice something or suspect something might be wrong, see your family doctor. For more information about SCFE and other hip disorders, or to make a donation, visit imahippie.org.